Hello, hello. My name is Jones, and today in mental health, we are going to look at crisis. Crisis is one of those major topics in mental health because of crisis, some patients or some clients may have a breakdown that may lead to a psychiatric condition or that may lead to a problem within mental health. So, the objective of this lesson is that we are going to define the term crisis. We will describe the signs and symptoms that a patient with crisis may present with. We are going to describe the types of crisis. We will outline the stages of crisis, and we also explain how to manage a client with a crisis. To talk about crisis, we need to appreciate that stressful situations are a part of everyday life. Any stressful situation can precipitate a crisis. Crisis results in a disequilibrium from which many individuals require assistance so that they recover from it. Hence, crisis interventions will require problem-solving skills that are often diminished by the level of anxiety accompanying the disequilibrium that the client may be facing. So, each and every day, we face stressful situations. These stressful situations, we try to solve them by using habitual problem-solving methods. From there, we try new methods to try to solve our problems. And if that fails, we'll seek intervention from our friends or counselors. And then if that fails, we may go into a dilemma, but an expert necessarily can come in to help. So we have stressful situations that we can not necessarily deal with as individuals, and every time we need a shoulder necessarily to lean on so that we solve our problems. By definition, a crisis is defined as, that is according to mental health, okay, because different scholars may have different versions of how they look at crisis. But in mental health, we can look at crisis as a sudden event in one's life that disturbs homeostasis, during which usual coping mechanism cannot resolve the problem. Okay, so that is just one way of defining a crisis. But other scholars have also looked at it as a subjective reaction to a stressful life experience that compromises an individual's stability and ability to cope or function properly. So, if an individual fails to cope with some life experiences, this individual may experience some instability in their life function. Hence, we can look at it that they are having a crisis. Okay, so these are definitions that have been drawn from different scholars. Okay, for this discussion, I just had to pick on two scholars' the definitions. Okay, so the definitions that I have put up, to define necessarily crisis. Crisis, necessarily, we are looking at a certain situation that you as an individual, you fail to cope up with, and then it disrupts your homeostasis, or it disrupts your stable way of living and your ability to cope or function properly. Okay, so it's important that whenever we're trying to put up a definition, there are certain elements that we should retain. So homeostasis has been disturbed in a crisis, and an individual cannot function properly. So those are some of the strong items or elements that are coming out, okay, on the definition of a crisis. All right, so let us appreciate some of the signs and the symptoms of a crisis. Of course, this will be our clinical presentation of someone who is necessarily having a crisis. So, an individual experiencing a crisis may be helpless to change and other things that are happening within their environment. They may feel they have no control of the things that are happening, and they may fail to cope up with change within their environment. So, an individual in a crisis will not believe that they have resources to deal with the precipitating factors of the stress that has led to them having a crisis. So they might not feel that they have the solution, so they go into this negative mental health state. Then the other signs and symptoms of a patient with a patient in a crisis is that the levels of anxiety are going to rise to the point that an individual becomes non-functional. Okay, they may have obsessional thoughts, and their behavior of relief for the crisis that they are experiencing may be abusing drugs, taking alcohol too much because of the crisis that they're having. So they might take alcohol to a point of more like a person who is parasuicidal. Okay, so all behaviors in a crisis is aimed at relief of the anxiety that the patient is experiencing. So for others, it takes them to that. Whilst the others, because of ineffective coping, they may also experience appetite problem, either not eating, or others they might eat too much. Okay, just wanting to just eat not necessarily thinking of the future. Okay, so anxiety is one of those cardinal signs and symptoms, in that the patient may be acting in severe panic. Okay, they may be panicking, thinking when you panic, then the solution is going to be found quickly to their problems. Otherwise, they will have disturbed the thought process, which impedes their judgment or affect their judgment. Okay, so for some people, like those that are being a crisis because of, let's say this person was raped, they may suffer what we call rape trauma syndrome. Okay, so there are these negative effects that can be seen because of the trauma of rape, so they may suffer from what we call rape trauma syndrome. Okay, so that is depending on the type of cause of the crisis. So in this case, that was coming because this person was raped in, maybe it was in a war or by thieves and the like, so they may end up having some kind of crisis. Okay, others may also experience some post-trauma syndrome after the shock of the experience of something that brings about a crisis in their life. They may feel the traumatizing effect of their situation. Hence, each and every time they want to venture into something, they have a lot of fears. Okay, in trying to have partnership and the likes, because they were disappointed in a certain partnership. And then they may have insomnia or generally sleep disturbances because they are busy thinking about the solution to their problem, each and every time. So their sleep pattern is going to be affected. Anyway, others also become violent, that is at home or at work. They may show signs of violence. Okay, so we talk of domestic or workplace violence. So why would this person, why? Because, at workplaces we have bullies. Okay, these people who sometimes find pleasure in talking negative about their friends. This person loses a job, goes to another, and then you find that at this job again they start behavior, so they may resort to violence as a way of showing dominance. But in actual sense, they are having a crisis. Okay, so with these signs and symptoms discussed in a crisis, we can now look at types of crisis. Okay, so in looking at types of crisis, anyway, we are going to talk about maturation crisis. Then we'll discuss a situational crisis. Then we'll also look at adventitious or social crisis. Then the fourth one that we are going to look at is mental illness crisis. Okay, so when you're talking about maturation crisis, I like making reference to Erik Erikson's developmental stages, which talks necessarily about challenges that we face as we are growing up, and these challenges have to be resolved in order for us to mature for our age that we have attained. So when you talk of maturation crisis here, you have it is quite a predictable kind of crisis where an individual experiences one stage of human development, and then that stage which they have experienced, as they are supposed to move on to the other stage in their life, they fail to cope up because of the changes necessarily that have happened in their lives. So in maturation crisis, we are saying it's predictable and it is a transition for an individual so that they can adapt to a new stage. Each and every day, there are changes that are happening in our lives. So maturation crisis is just looking at the way one needs to mature and accept transitions. Okay, transitions of life or transition in life. So maturation crisis is predictable. That emphasis necessarily we have to make. It's predictable because it is part of growing up. It's part of growing up, part of challenges of necessarily leaving the other childish things in the past and accepting the mature things that we need to start embarking on. Okay, we can say maturation crisis by definition is a predictable transition in which an individual experiences a movement from one stage of human development to another. So that is how we can define maturation crisis. So at various times, every individual must make adjustments and adapt to new responsibilities and life patterns. Those transitional periods or events most commonly known to increase the risk of crisis for an individual are the issues of adolescence, marriage, midlife, retirement, and other examples that we can necessarily think of. So these transition periods often produce a disequilibrium when persons need to make cognitive and behavioral changes that accompany development. Successful transition depends upon previous successes and the availability of support. The role model that have influenced this person, in order to enjoy the fruits of transition and also the acceptance of other person's new role, then this person is going to avoid this maturation crisis. Okay, so maturation crises are predictable and can be prepared, and an individual can be prepared for it and prevent it if at all in life they are given a certain platform through the help from people that have passed through that stage, or they have mingled with people that have passed through that stage and they have seen how they were coping. So proactively identifying actual or possible change that the event will cause, then taking steps to become more prepared for those changes can minimize the disruption. For example, a young couple can take parenting classes to help prevent pediatric head trauma that could result from shaking their infant out of frustration during a period of uncontrollable crying of the baby. So they can attend parenting classes, okay, so that when they have a baby, they know how they will deal with these crises. Okay, so that is in the maturation crisis. Okay, we have dealt with maturation crisis and a lot of things that are involved there. Let's now look at situational crisis. Situational crisis, accidental issues that arise suddenly and unexpectedly from an external source and poses a threat to the physical, social, and the psychological integrity of an individual. So we have a situation, okay, we have an event, we have an accidental issue that has happened unexpectedly, and this affects an individual's physical, psychological, and social integrity. So this then creates a crisis in an individual. Situational crises often revolve around grief and loss. Okay, so they revolve mostly around grief and loss. These events may originate in the physical body as a result of a disease or an injury, or in a social or emotional situation. Okay, so that is emotional situations such as loss of a job, divorce, mental illness, death of a loved one, moving to a new location, or failure in school. One fails, so you have to deal with that situation. Okay, sometimes maturation and situational crisis occur at the same time, and occasionally one crisis triggers another, compounding the problem. The example that I can give here is a teenage boy and a girl are attracted to one another and experiment with sexual intimacy. When the menstrual period of the girl is late, both adolescents are thrust into a state of emotional disequilibrium as they experience both the maturation crisis of adolescence and the situational crisis of potential pregnancy. The action they take to resolve the crisis may thrust them into even greater confusion and turmoil. Okay, so there are a lot of things that may affect menstruation. So after this, sexual intimacy, the girl will think now she's pregnant because she has missed her period. Informs the boy, and then now the only thing they can think of is pregnancy. Okay, so that is a situational crisis, and I've given a situation, okay, in which a crisis may arise. Then let's look at adventitious or social crisis. Adventitious or social crises have been called events of disaster. They are rare, unexpected happenings that are not part of everyday life and may result from natural disasters, national disasters, interpersonal disasters, or acts of terrorism. So when I'm talking of adventitious or social crisis, they may come from natural disasters such as floods, fires, and earthquakes. When we talk of adventitious or social crisis, they may come from national disasters such as airplane crashes, riots, or wars. Social crisis may also come from interpersonal disasters such as assault or rape. Social crisis may also come from more acts of terrorism that disrupt the normal life of the community. Because of the severity of the effect of such events, normal coping strategies may not be available because mental professionals must then respond quickly to large numbers of people at a time, including including the entire community. So the person who has been experiencing this, like in times of war, you are going to find that you have to now meet new people, adapt to new life, and necessarily not knowing whether you are going to achieve your life goals, because your schooling might have been disturbed and all those things. So you need a professional counselor to step in and necessarily deal with this large community of people, so that they can be established and come out of this crisis because of the many losses that they may experience. Then we can talk about the fourth and the last crisis for our discussion, which is mental illness crisis. Individuals living with mental illness face the same stressors as persons who do not have mental illness. But these stressors can be especially difficult to deal with for someone living with a mental illness. Crisis can occur even if the person has been complying to the treatment or has been following a crisis prevention plan. Patient has been using the techniques that have been learned from mental health profession. They can still end up having a mental illness crisis. At times, the person may present with behaviors that indicates an impending crisis, but other times a crisis can occur suddenly and not necessarily with a warning. So, because of just having a prevention plan does not mean someone cannot have a crisis. Because of the lot of things that they necessarily they need to process, they may end up having a mental health crisis. There are some individuals that are prone to having this because of lack of necessarily proper socialization, lack of survival skills, and the like. So each and every time they face a problem, they may end up having a crisis. Okay, so let us now appreciate some stages of crisis. Okay, so the stages that we are going to discuss here of crisis has to do with psychosocial assessment, building a rapport, knowing the cause of the crisis, dealing with emotions, and also finding alternative to the solution, coming up with an action plan, and making a follow-up. So these the stages of a crisis or managing a crisis. Okay, so within these stages, we'll look at the stages that have to do with necessarily what happens in stage 1 of a crisis, what happens in stage 2, but otherwise under counseling, general counseling, we have necessarily recorded a lesson to do with the stages that necessarily one goes through to do with stage 1, 2, 3, 4. But now these stages are the stages on how necessarily a crisis can be managed. So a crisis can be managed for these health experts. They need to do what we call a psychosocial assessment. They need to ensure that they have built a rapport with the patient, because if a rapport has not been established, it will be very difficult to help the patient. Then they need to know the cause of the crisis. Okay, they need to identify the cause of the crisis. I'm looking at this more like problem solving, because a crisis will come because there's a problem. Then you have to deal or act on the emotions. Okay, so the emotions that come because of the crisis. And then apart from that, you can look for alternatives or alternative solutions. Then draw up an action plan and make a follow-up. Okay, so when we say psychosocial assessment in the stages of crisis management, assessment leads to gathering of baseline data with respect to the crisis situation that is experienced by the person. It should be emphasized that in this stage, the behavioral health coping mechanism that is used, and the risk of suicide are determined for the patient, so that we can effectively prevent the patient from committing suicides. Okay, so in psychosocial assessment, you gather baseline information with respect to the crisis situation that the client is facing, and make emphasis that the patient is out of danger. Then, from this stage in managing a patient with crisis, you have to build a rapport. So, to further help the patient in crisis, we need to get relevant information that is important to build this relationship. Okay, that the person who is experiencing this crisis will realize that there is genuineness in the kind of help that you are giving or that you are extending as a health worker. You don't have to treat the patient, as just a thing that has come, and then you just give the information and then they act on it. You need to show empathy and sympathy at the same time, so that the patient knows that you feel for them, and you don't have to take it as if each and every person experiences this. So this is not unique. Each and every situation is unique. So build a rapport. Don't just give patients attention to just follow the professionalism that is needed for you as a mental health counselor, but try to show interest in the person that is there, and not you necessarily just following the professional ethics that are there. So this will make the patients feel comfortable that you are interested in their case and you really want to solve their problem. Okay, so in talking about solving their problem, you should know the cause of the crisis. So this is the stage where the crisis worker or the health worker would like to know what made the client to ask him for help. It is also important to elucidate, that is, to explain what coping methods were used and how these methods failed to address the crisis situation that the client is experiencing. So get to the bottom of the case of this crisis, so that you know what has led to this crisis and how the other methods that were used, that the patient has been using traditionally or habitually, have not necessarily worked. Then, after knowing the cause of the crisis, you can now deal with the emotions. At this point, the skills of crisis worker in terms of active listening and the use of challenging responses are put to use. Here, the crisis worker must be prepared to listen and reflect on the feelings which are being vented. Okay? That have been vented or that have been expressed, that is negative emotions and the likes. So these are being vented by the patient, of course. The appropriate challenging should be judiciously interjected into the conversation, so that the maladaptive coping mechanism employed by the client can be corrected. For instance, if the client tries to take sleeping pills in huge dose, okay, this in order to cope with the hate that he or she is feeling, then the crisis worker should make the client reflect on such actions that are being taken. The crisis worker must make the client realize that it is not the best solution, okay, for the patient at hand. You sleep and you wake up to the same problem. If at all you decide to abuse drugs, you are just worsening the problem, because it is not taking away the problem but increasing on the problem, because that time lost would have been used to solve your problem. Then after dealing with these emotions, then you can find the alternative solution. The crisis workers are trained to establish a suicide contract with its clients. It is at this point where different options are laid on the table, and each one is discussed in order that the pros and cons are checked. This is the most challenging stage, as the client at this point may have panoramic view of the crisis that he is going through. Oftentimes, the clients will dodge on the discussion of the topic of suicide or other things in relation to suicide. So the crisis worker needs to step in and must present the reality of the situation. There are some people who are facing crisis. They are owing a lot of people money. So you need to counsel them and see how necessarily they can come out of this debt by not killing themselves. Okay, so as a crisis worker, you try by all means to give solutions and bargaining to the patient on how best their problem can be solved as they move on, necessarily without committing suicide. Mostly patients will look at suicide as the solution to their crisis, but this piles on the problems to the people that will remain, and it is negative on that part of the patient, because as people talk about this, then even those that did not know about the situation will know the situation, so they would not have saved themselves from the embarrassment. Okay, so it is not how many times you fall, but it's how many times you rise up and fight your battles, fight your challenges. Necessarily, that is what inspires people to follow you and people to respect you. You may fall 10 times, but how many times did you rise up to solve your problem? So find the alternative solution. If you can find the alternative solution, then you have to draw some action plan. The action plan implementation stage is important so that the client can be assisted in ways to better handle the crisis that he is facing. Cognitive and behavioral responses with regards to the crisis need to be set out in the action plan. So you can help the patient with the roadmap on how they will solve the situation that brought about the crisis. Was it a death? Was it grief or loss of a loved one? Okay, this time we have a lot of people with financial problems necessarily that have landed themselves in a crisis. So as you are counseling them there, you can try to give them a financial plan on how they can solve their problem, or a business plan on how they can solve the problems that they're having. Okay, so the last stage in this crisis management of the patient, crisis stages of managing patient or necessarily with a crisis, is that of a follow-up. A holistic approach in evaluating how far the client is able to progress from the crisis needs to be done at this point of follow-up. Therefore, a regular follow-up of the progress that the client is making is essential. The crisis worker should make sure that the effectiveness of the action plan to address the different crises is that the client is experiencing is being followed, and it is yielding some results. Remember, some clients may come 1, 2, 3 times, but by fourth time or so they might not necessarily come. So it's important to make this follow-up so that you see that your advice is yielding results and the client is following up on the things that needs to be done. Okay, so in our next lesson, we are going to look at management of crisis or crisis intervention. That is the next part that we are going to look at. For now, we are just looking at crisis. Okay, we defined crisis. After defining crisis, we have looked at the signs and symptoms of crisis. Okay, and then we have looked at the stages of crisis. And then apart from the stages of crisis, we have also looked at some of the stages in managing a patient with crisis. That includes psychosocial assessment, building a rapport, knowing the cause of the crisis, dealing with the emotions, ending alternative solution and action plan, and then lastly, a follow-up. Okay, so these are the stages that you can necessarily use in managing a client with the crisis. But otherwise, there are other stages that they talk about of a crisis. That is, in stage 1, necessarily what happens when the patient is faced with a problem or that they fail to solve. Okay, then the stage 2, stage 3, and the like. That one has also been covered in our lesson in psychology, which I'm encouraging you to look after. To look up to. So when you're done with this lesson, you need to look at also or follow up or listen to a video that we have recorded on management of crisis or crisis intervention, because these interventions will now help our patients regardless of the type of crisis that they may have. It can be maturation crisis, it can be situational crisis, it can be social crisis, or it can be mental illness crisis. So what are the many interventions that are there in managing crisis? So once we can do the management of this, then we can manage our patient despite the phase of stage that they may be in the crisis. Okay, so from me, I'm saying thank you and keep studying.